One area that I like to work in is pre and postnatal care of women, so while they're pregnant and after they're pregnant. A lot of women experience discomfort during their pregnancies and just think it's part and parcel of being pregnant. They don't realise that there's something they can do about it. So things that I'll commonly see would be sciatica, so pain in the buttocks radiating down to the back of the leg, or back pain, pelvic pain, upper back pain as the breasts are getting heavier and bigger. So it's basically all related to there's extra weight at the front of their body and their body's trying to adapt to that. Their centre of gravity is changing and their body sometimes can't adapt to that quick enough. At the same time, you've got a lot of hormones going around your body that are preparing you for the labour by making all your ligaments quite loose. So that leads to instability and pain. So there's a lot that we can do as osteopaths to help relieve discomfort in pregnancy, and we can modify our techniques for whatever stage the woman might be in. So we can do techniques side lying or seated. I actually have a pregnancy cushion which allows women to lie on their bellies quite comfortably. So it's very safe during pregnancy. By making sure that the mother's body is functioning well, particularly that there are no restrictions through her pelvis, means that she's more likely to have an easier labour, because if the body is functioning well, then obviously the baby's going to be able to get out easily enough. It also helps to achieve an optimal birth position. So, you might have a baby that's breech because the mother's pelvis is compressed or restricted in some way that doesn't allow the baby to turn. So by releasing any restrictions through the pelvis, it can sometimes allow the baby to turn. I treat a lot of babies and children. A lot of people think that, if a baby's just been born, they shouldn't have anything wrong with them. But a lot of children do actually have a lot of strain from the birth process itself, or sometimes prenatally. So if they have been in a strange position during the pregnancy, they might have different strains through their body. So if the baby has been breech, which means upside down, so bottom first, they tend to have a lot more strain through their legs and lower limb because they've been squashed. If the birth has been prolonged, the baby might have some strains through their body. If there have been any interventions, so a vacuum extraction or forceps or even cesarean, can all have an impact on the baby. And strains through the baby's body can be manifested in terms of symptoms like colic or reflux, irritability or feeding difficulty, so difficulties attaching onto the breast or even trying to take a bottle. So that's a very rewarding part of my work. I really love treating infants and children because you can make such a change to their lives and to their parents' lives. So the treatment is basically aimed at relieving any restrictions that they might have through their body so that it can function better and therefore help relieve the symptoms. So the treatment, I guess, itself is very gentle and subtle, but involves relieving those restrictions that could be contributing to those symptoms. So relieving any structural strains that the baby might have from the birth process or even prenatally.